Well with Chronic Disease program was started by Stanford University several years ago. It's an evidence-based program, and that means that Stanford created the program, tested it on at least 1,000 people, and followed those people for 3 years, and then contacted them after the 3 years and to see how they were doing. And in general, the people responded that they had more energy, they had fewer hospitalizations, they had better medication management, they had better relationships with their doctors. They were all positive responses to dealing with their chronic condition.
The chronic condition differs from what we call an acute condition, such as a cold or the flu, in that the acute condition is time limited. It goes away. You get over the cold, you get over the flu. But a chronic condition is usually something that we deal with for the rest of our lives. My arthritis will never be cured, for example. I just have to learn to manage it and deal with it, which is what the course is about.
There's a lot of people with a chronic disease. They're going to have to live with it. Living their best life is important to everybody. And through this program, they can find techniques and tools that can help them take charge of their life. It will empower them and help them live a healthier, happier life, and that's a good thing.
Well, for patients with chronic illnesses, whatever the chronic illness might be, there's only so much that physicians can do. There's only so much that other healthcare professionals can do. So there comes a time when you need something extra or something to fill in the gaps. Physicians these days are busy. They seem to be on a treadmill. Sometimes it's hard to just find the time to talk to someone. In a group situation such as a class, you have the opportunity to sit down, relax a little bit. Those questions that you keep thinking about on the way home will come to you, and you can get them asked and answered while you're in a class or a group setting.
The Living Well program covers healthy eating, for example. We learn how to read food labels, nutrition labels on food. It covers medications. The students give each other tips and hints on how to remember to take their medications. Interactions between medications are talked about.
Goal setting, the importance of physical exercise, how to handle emotional ups and downs, the role of stress, how important it is to learn relaxation techniques. And also a big part of it is communication with our healthcare provider and taking responsibility for our own conditions.
I think it gave me an idea into what I could eat better, read the labels better to find out just what I could have that would help without overloading the body and help decrease, like your cholesterol, keep your blood pressure lower and everything.
Students are expected over a 6-week period to show up for class for 2 hours a week for the 6 weeks. And there are some activities that we ask them to perform between the week, each week, homework assignments essentially, where they're asked to do an action plan and follow through in that action plan, and we ask them to deal with it, to report back. We ask them to keep a food journal so they learn about their eating habits and that sort of thing.
It seemed a little daunting to them to be here for 6 weeks and be here for 2 hours each day, but once they, like I said, once they got in here and saw the resources that they were being offered and the training that was given to them and the ways to cope with different things that they were coping with, and then also having that support from other people that had other diseases and other pain issues. It just became a great support system for them, and they look forward to being here, and their comments were, you know, the time just flies when we're here. So it was a very appreciated program that Living Well is about.
Self-management is the foundation of this program, yes. It's very much learning to deal with a chronic condition is about managing ourselves, managing our emotions, managing the difficult emotions we may have, managing our medications, that sort of stuff. So and that's what really has led, I think, to the research that we've been told, the findings of the research, rather, in that people learn to manage their diseases better, and therefore they're not calling their doctor every time something new comes up, or they're not running to the ER every time something new comes up.
I think the important thing is to look at the long term. Are there active things that I can do to make them better? Some things we don't have much control over other than medications, so like multiple sclerosis is highly going to be medication dependent, so whereas type 2 diabetes sometimes can be managed with lifestyle alone if you do it correctly, or even plain old high blood pressure, for example. High blood pressure, some people forget that it's not just pills. There are actually some good approaches, for example, the DASH diet plan, where adopting that diet is just as effective as adding a blood pressure medicine. Sometimes there's other things you can do that are also add up to being another medicine. So for example, exercise can be just as effective. Stopping alcohol if you drink too much, stopping cigarettes, each of those individually is the same as a blood pressure pill. And so if it is possible to go from taking 2 blood pressures of pills a day to none if you were to make enough changes in your lifestyle.
I decided I needed a change in my life. I wanted to know how to do it and what I could do to make my life better and maybe others around me. My sis is a good example. She's a worse food junkie than I am. And I've been after her and just recently have started teaching her what these food labels mean and everything. And she is really responding because of her own problems. So, and she's got a 9-year-old grandson that's a little chubby. And she's getting him interested in it. And he's beginning to realize what he's eating isn't helping him at all. So I think it's impacting their lives too.
There's just so much information in the resources that they give the participants, and it's free. What more can you ask to get great resources and not have to pay a dime and have it help you?
The program is definitely interactive. We have many sessions where we include brainstorming or list making, problem solving. As I said, the goal setting is done by each individual. We want the people to be involved each and every session, and we are just there as facilitators.
I know one of the participants that is a member at our facility, she said that it was nice to even to see how she can deal with her own pain and chronic diseases, but how other people are coping with their issues that they currently have. So it's, like I said, it's just a great support system.
We have had people benefit from this class who were as young as 20 or in their 20s, and people as old as 100, over 100 years old. 2 that I can think of that were in their 20s. One was a young woman who had just gotten diagnosed with lupus, and she was very happy to be in the program, and her mother was here with us. So people of all ages and all conditions, and people who also help take care of people are also welcome in the classes and benefit from them.
Yes, caregivers can benefit, partly because their situation is one that has a lot of stress with it, so they can learn how to deal with their own situation. And also, what is the person you're giving care to? What are they going through? And get tips and hints from other people who are in the class as well. In fact, when I was a student in the class, I was a caregiver for my father, and it really helped me to understand what he was dealing with and to be more proactive in helping him deal with it.
Attendance at the Living Well sessions has been overwhelming at times, and then we've had some small groups, but it didn't really matter how many people were in the group. All the participants have gained and have easier, healthier, happier lives afterwards.
A little change in my attitude, happier, trying to help people more, learning how to live a better life, better diet, exercise to benefit my problems, and learn how to cope with them better.
It's a valuable program in that it allows us to look at ourselves and allows us to make the changes that are most comfortable for ourselves. We don't encourage people to do anything that's outside of their comfort zone necessarily, or outside of their abilities.
I think more people should take this program. It would help impact their lives a lot.
The Williamsburg Hy-Vee decided to host the Living Well program because the program goals and our mission at Hy-Vee are so similar. At Hy-Vee, we like to make life easier, healthier, and happier for our customers, and Living Well wants to make life easier for the participants in the sessions.
To know that our facility is able to help them, alongside with Lincoln Lancaster Health Department and Aging Agency on Aging, that we are part of their healing. That's kind of what the Y is all about, is healing and helping other people. And I think being given that opportunity just helps us to feel like we're part of a bigger picture in our community.
We try to offer the residents a variety of activities and events, and one of the things that we like to do are educational programs, health wellness programs. In addition to that, I have family members and friends with chronic diseases. I know how impactful that can be on your life and how taking charge can improve the quality of life, and so it was a good fit.
A lot of participants in certain areas of town or in certain ages, they don't really want to drive very far. They're not comfortable getting out of their community, their small neighborhood. So the more places we can offer it to make it convenient for people and make them comfortable, I think is a huge benefit for not only Lincoln, but surrounding communities and the state. So it wasn't a hassle. People, like I said, people were extremely appreciative of it.
If another facility is thinking of hosting Living Well sessions, I would encourage them to do it. Whatever we can do to help people going through difficult times is beneficial for us all.
It's helping me. I quit smoking for, a couple of days. I smoked 2 cigarettes, 3 cigarettes a day, and and I said I can quit.
As far as feedback from the participants that are still members here in our facility, they thoroughly enjoyed it. They would definitely recommend it to any of their friends and have recommended it.
If anybody is thinking about attending the workshops, I would strongly encourage them to pursue more information and to enroll. They won't be disappointed.
For more information or to register for a workshop, call Sandy Keller at 402-441-4605 or email at skeller@lincoln.ne.gov.